Welcome to another episode of Health Coach Talk. My guest today refers to himself as a health motivator, but he didn't always start out as a health coach. He had a long career in traditional acute care medicine, and he then developed a chronic medical condition, type 1 diabetes, which he is going to talk about, and talks about this journey to eventually become a coach and the very, very important work that he is now doing. So let me tell you more about my guest, Mark Brezzell. He is an executive health coach, educator, and keynote speaker with over 30 years of experience spanning clinical medicine and medical affairs leadership in the healthcare industry. He's a former cardiovascular perfusionist who participated in more than 2,000 open heart surgeries. And he later transitioned from hospital-based care into industry leadership, bridging patient outcomes with strategic healthcare innovation. And now for almost 3 decades, he has lived with type 1 diabetes, bringing his lived experience to his work at the intersection of stress, physiology, diabetes management, and vascular risk. Today, he equips leaders and organizations to optimize performance, manage stress, and protect long-term health, because metabolic health is a leadership advantage. Absolutely. Well, I know you are going to enjoy my conversation with Mark. Welcome, Mark.
Thank you. Glad to be here.
Well, I'm so glad to talk with you. I'd love to start out. You have a really amazing background, and your journey being diagnosed with type 1 diabetes. Can you explain how that all came about and what that led in terms of a transformation in your life?
Well, it's actually very interesting. As I shared, I'm clinically trained as a clinical cardiovascular perfusionist. So I was a part of the heart surgery team at Toledo Hospital in Toledo, Ohio. And a year prior to my diagnosis, one of the anesthesiologists approached us about, updating and maybe revising and changing and putting some protocols in place for patients that were diabetic undergoing cardiopulmonary bypass. And so that was kind of an initiative where we started to review. I started to get into a little bit of the diabetes and just trying to develop ways of improving overall outcomes in this patient population. And, it was something, we got it off the ground. The very next year, I got married, the beginning of that year, in 99, I got married. And within 6 months or even less, 3 to 4 or 5 months into my marriage, I started exhibiting weird things. I noticed that I started losing weight, unexplained. I was very active at that time, but so I attribute it to just my activity level. But
Sure.
I still continued to lose weight, and it just progressed to other manifestations. I remember I had an insatiable desire for just drinking soda pop. My wife would even say, "Why do you drink so much of that stuff?" And I'm thinking, I just have a sweet tooth, not thinking anything of it. And I was just drinking this stuff like water. And I remember one day I was post-call and I was laying on, my couch and the phone rang and I jumped up and it was like a glare in my eyes, like somebody shining a flashlight and it just subsided. And I knew that was odd, but it went away and I'm thinking, what was that about? And so it was just a progression. And it wasn't until I was, one day post-call, I was driving home, changed in the car, and I had to use the restroom. And I'm thinking, just use the restroom. I haven't been drinking a lot, no water. I don't understand. But when I got there I went to a drugstore, and when I got into the drugstore, I said, something's not right about this. And that's when it kind of dawned on me. And so I went and bought one of those over-the-counter tests. And glucose test, and I took it, and it came back positive. I was floored. I mean, and it just blew me away. It just meant, so I contacted my doctor. I said, hey, I'm suspect that this might be going on, and he tested it, he confirmed it, And I was just basically floored. And I think when you think about diabetes, we so often focus on the pathophysiology of it, but we don't necessarily discuss the psychological impact and emotional impact it has on you when you when you get a condition that has so many tributaries, potential complications, of challenges, affects you. It affects your mood. It affects your thought process. On top of everything else that you're at risk for. And I just wanted to. I felt it compelled. I spent years in industry. I transitioned out of the hospital and I spent years. And so I think it was I bumped into a friend of mine a couple of years ago. And he was telling me about he almost died. He was spent about 2 or 3 weeks in the hospital. His kidneys were out. He was in acute renal failure, and he just was like, "Wow, I almost died." And I found out when I got there, I had diabetes, and that was the call to action for me. I've been in industry all those years, and I decided that maybe now is the time. I have experience in the hospital. I have experience in the industry. Maybe now is the time for me to be more of an advocate and educate, because even for me as a clinician, in the back of my mind, I'm thinking, it couldn't be that. That's not my story. But indeed, that was indeed my story. And so that's why I share my story, to let people know that it can affect you at any time, any demographic, doesn't matter, your zip code, it doesn't matter who you are, and doesn't matter your age, that you can become, stricken with this condition. And I just want people to be more aware of their bodies, because I always tell people all the time, you know you better than anybody. If something's not right, get it checked out. And so many times we sit on symptoms and we allow things to escalate out of control. And when we do present, sometimes they say, if you come months ago, weeks or years ago, if you come, we could have done something more for you. But so that's kind of my mantra now, is that when I educate, not only do I discuss the condition, but also try to emphasize to them that if something's not right, at least I'd rather them tell me nothing wrong with you than for you to go and for them to say, I wish you'd come here sooner.
Such an important message. So for those who are listening who may not know, there's a lot of confusion, type 1 versus type 2 diabetes. Can you explain?
Absolutely.
Yeah.
And that's part of my education. Well, type 1 diabetes is an autoimmune condition. Many people talk about autoimmune. That's basically, they may not understand the mechanism behind it, but basically your body attacks itself. And for type 1 diabetes, your body, there's some trigger, decides that your pancreas is not part of its own, and it attacks the very cells that produce insulin. They call beta cells. And so it could be genetic, it could be lifestyle on top of genetics, but mostly it's usually genetic. But even with that, they found that there's been triggers. But that's what type 1 is, and it's not something that's reversible. You usually the function of your pancreas will go down to minimal, and as a result, you have to give yourself the hormone insulin to control your sugars at that particular point, where your body is no longer producing the insulin necessary for that. Whereas type 2 diabetes is a little bit different. It's more around, we call it insulin resistance. And for type 2 diabetic, it is reversible depending on when you actually begin intervention. But and there's various subcomponents of that. Either the insulin cells are, either they're not producing enough insulin, or the body's not absorbing, the sugar that's in your body. It's just not being absorbed properly, or the insulin that is being produced isn't being utilized properly, which is driving sugar to the cells. So there's a lot of little subcomponents to type 2 diabetes, and actually it's the most common presentation of diabetes as well. Most people, when they become diabetic, usually become a type 2 diabetic. And like I said before, your pancreas sometimes is overloaded trying to compensate for the highs and the lows, for your sugar not being controlled as well, and eventually it gets tired. And usually, if you can catch yourself in that period before the pancreas completely elapses or is severely damaged, then you can, by proper diet, by exercise, or even some medications for some people, you can actually reverse that course if the cells have not been totally damaged. But that's usually the difference. Type 1 is autoimmune. There's no way of reversing it outside of some of the new technique advances out there.
Yeah.
And type 2 is reversible or is easily controlled, can be controlled by diet, by exercise, and medication. And it can be reversed depending on a lot if your body is able to recover from the early lesions.
Yeah, well, thank you for that explanation. And I think it's exciting that there are, we tend to think that there's nothing you can do, but
Yes.
becoming the CEO of your own health, the importance of lifestyle changes.
Absolutely.
And so
right.
it's really, that's the role of a coach. And that's where you came in. You have become a coach,
Yes.
correct? Yeah.
That's right. I try to help people, they ask me all the time. I said, "When did you get into coaching?" I said, "Well, when I acquired a condition that I live with every day." I said, it gave me a certain level of experience that I didn't ask for,
Yeah.
but that I have.
Yeah. Yeah. And so many people come to our school, FMCA, because they themselves or a loved one has been diagnosed with a condition, and they now want to support others to take charge of their health, and find that they are now finding meaning and purpose in this work. And
right.
yeah.
And there's nothing more powerful than a testimony. So
Yeah. Yeah.
absolutely.
And you work with a wide range of clients. You do
Yes.
some corporate coaching. Can you talk about that?
Yeah,
Will you see?
again, because I spent years in corporate, my last company was a medical device company, and we were developing, actually, ironically, devices in one was a carotid stent that we could put in the carotid artery to kind of open it up to prevent, strokes. And then also for devices in the lower legs as well, that could open up the vessels to prevent, further limb damage or injury from ischemia. We call it peripheral arterial disease. But I try to help people understand all that. But yes, the focus of, I reach out to companies, I work, executives, because I think what people don't understand is that when we focus on one condition, we miss the whole picture. The cardiovascular system, particularly the vascular system, is a whole system. The same process causes the same issues. It just doesn't. It just is a different location. In the head, you can have a stroke. In the heart, you can have a myocardial infarction. In the legs, you can have limb ischemia, which leads to potential amputations if it's not corrected, that sort of thing. But it's the same process that generates these blockages, all throughout the system. So what I try to help companies understand is that stress, and that's where the foundation of my interactions with the companies now is around stress, the vascular impact of stress, and how but people understand stress is just more than just a state of mind. It's a physiologic event. And so I hope people understand that if you undergo prolonged stress, that can even preclude you from getting a condition like diabetes, because that in of itself causes your body to react a certain way where your liver exudes extra glucose, which raises your level. And then the pancreas is trying to compensate for all these things. And again, that cycle can generate certain, manifestations of diseases in your body. So I try to help them understand that we get so when we're in our zone, the last thing we pay attention to is us.
Yes.
And you can't have a productive workforce if half of your workforce is being, is out sick or being treated in the healthcare delivery system. I said, this is an expensive condition. I mean, you have medications, you have therapies, there's a lot of, it tells more than just, productivity is availability. And if you don't have a healthy workforce, you won't have an available workforce, and your productivity declines. So that's one of the focuses. Another is for nonprofits, where I educate the community and help people understand the benefits of health. We all know that our healthcare delivery system may be a little bit, detached and broken. But even with that, we know that if we take better care of ourselves, then we won't be as exposed to the system. And there's things we can do. It's very simple, health is more than just a pill. It's a lifestyle change. And that is something I guess the reason why I share with passion is because with years of interventional surgery, interventional techniques, we did open heart surgery. And, what I discovered over the years is that, okay, we have the technology to prolong life. But if you don't change the lifestyle, then you're going to be right back to where you started from.
Yes.
What can you do to minimize that repeat of the infect, of the onslaught that you dealt with initially? So I meet with organizations, I meet with churches, I meet with businesses, from executive level to help understand the impact of employee health. I meet with, public health organizations, just sharing the information regarding, what are they developing? What is diabetes? Trying to clarify the myths. Like you said, there's so much misinformation out there with social media that I try to help clarify. And then I also talk on the impact of stress, how, stress has such a subcomponent of harm, and what can we do about it? What are ways that we can kind of reduce our stress? So yes, I meet so many different levels, in law, because, there are very high stress areas, in finance, very high stress areas. So I target areas where people, as a way of life, endure an exuberant amount of stress. And when you talk to them and you let them know, listen, this is what's going on in your body, that kind of shakes them out of that doldrum where they have the blinders on. I just got to do what I have to do, what I have to do. And maybe you have to, take a pause, a time out. Well, what can I do to improve my situation? Maybe instead of on my lunch break going and getting the burger, maybe I just go for a walk around, the building, or walk around in the parking lot, or just getting some fresh air and some sunshine, and just kind of, to kind of reset myself for the latter part of the day. Or when I get home from work, how can I take the load of my day off where I can not damage my body so much? Just by just permeating this and then going, working, then eventually eating, then going to bed, and then getting up and start the same cycle all over again. So I think a lot of it is clarity. A lot of it is perspective. And a lot of times when you're in it, you don't see what you're doing to yourself. But when you someone can at least talk in your ear and say, hey, this is going to cause problems down the road. Are you sure you want to go down this road? It kind of makes you balk a little bit, so that's kind of my focus. And yes, all the different organizations, particularly that deal with a high amount of stress, because everything's all interconnected. It's all intertwined. And we're really good at keeping things separate.
Well, you are speaking my language, and the impact of stress. And it's so encouraging to hear you address that. I don't think it's focused on enough.
It is not
because, and it really has to do with mindset. And many years ago, when before founding FMCI, I was a health psychologist, and I saw a lot of people who were coming out of cardiac rehab, and what we would say is this worth dying over? They'd get all upset about something, say that take it to that level. Is this so important? It's worth dying over? Because that's, and understanding that stress response, and the wear and tear, especially on the cardiovascular system. And, absolutely, it is prevention. It is looking at the effects of what you're eating and how you're moving and sleep and managing your stress and relationships. And those are things that you can control, so that, as you said, you don't end up where getting your open heart surgery and returning.
Exactly.
Because, in Western, we are acute care medicine is the best in the world. You were there. You saw what's possible. But you want to prevent that. You want to stay out of that operating room as much as you can.
That's right. When I left the hospital, I told my colleagues, I don't want to see you guys again on this side.
Yeah, that's right. Yeah, it is really, really critical. And there's an old saying, you can't see the label when you're inside the jar. And that's what coaching is about. So helping you to see the label, because when you're in it, you often can't see the bigger picture, the perspective. And perspective is so critical, and a coach can guide you to zoom out, have a broader lens, and have some perspective, what really matters to you.
That's right. It's interesting when you talk about perspective. One of the things I share with an audience, that I talked about how, a lot of times you want an example of perspective. When you buy a new car, isn't it interesting that when you buy that new car, then all of a sudden, even on your way home from the dealership or wherever you bought the car, that's all you see.
Yeah.
You see that car. Like, wait a minute. I've been driving in this neighborhood all this time. I didn't realize that so many people had this type of car. It's all about perspective. And so, when you're in it, when you're zoned, you're laser focused on what you want to do. But when you can step back and then broaden your horizons a little bit, then you maybe start to recognize maybe this is not a good thing. Maybe I need to make some changes.
Yes, absolutely. Yeah. So what do you find, and when you go and talk to these companies, are they receptive? Do they get it in terms of would they understand the ROI? Because really what your coaching is about is improving their ROI.
On the employee levels, yeah, even on the corporate level, I think they're starting to get it more, because I think when you on the corporate level, when you start putting it in dollars and cents for them, thinking, okay, this is what the average expenditure is for this particular condition. And, for them, when they see the numbers, and sometimes that's where the red flags kind of pop up. It's like, well, I did not know that, or I didn't really pay attention to that. But from an employee level, it does resonate, because many of them have friends, have family, have people with that sphere of influence that are dealing with some of these challenges. I've talked to people, I call diabetes the 3 degrees of separation. You know somebody who knows somebody that's dealing with diabetes. It's not that stuff so far removed anymore, because it's so prevalent and is growing, and almost in epidemic proportions here. So, I think that when you heighten that and help them understand what, that is preventable, unless you obviously type 1. But even with that, with type 1, you can still have a good life, and you can prolong it, yourself. Because I was even told, one of my doctors, an endocrinologist, says that, if you're able to keep your A1Cs within, good, safe ranges, all the years of his practice, he's never seen a lot of complications for individuals who kept their A1Cs within target ranges. He says there's always the ones that are way out of the range are the ones that are dealing with complications. So it doesn't really matter where you are, what you've been stricken with, whether you have type 1, type 2, just kind of educating them that changes can have a lasting impact on outcomes and health. And you have to have a change in mindset. And I do get a lot of questions, and people are very interested, because I don't just talk about the condition. I talked about what you can do to like you said, prevention. And so I talked about 8 key health principles: fresh air, sunshine, drinking water. Are you getting rest? All of these components are necessary for premium health, and also help you whether you're dealing with a chronic condition, prevent you from getting a chronic condition. All of these things are interconnected.
So true. Yeah, that's the premise behind functional medicine. Everything's interconnected.
That's right.
So when you are doing coaching, is this one-on-one consultations, or do you have groups? Is it both?
Mostly it's been presentations to groups.
Okay.
But I'm branching off. In fact, I'm now willing to do one-on-one consultations, because I've done it for years without it being a business.
Yeah.
People approach me and wish they'll share their story or their challenges. And I've always been an advocate in that regards, where even within my family, if someone's sick or someone's in the hospital, they'll call me, Mark, can you this is what's going on, and I try to explain to them what's going on, or what does it mean, why are they doing this test. And so from that, I've had a lot of one-on-one outside of the auspices of my business. I've been doing that for years. Now I'm just doing it as kind of a foundation for part of my platform. And yes, I'm willing to talk to anybody. Doesn't matter who you are. Doesn't matter where you come from. Health is wealth. And if anyone's interested in talking to me about their health, I'll be happy to give you guidance and direction to the best of my ability. I have resources with the work that I've done. I spent time as a medical science liaison. So we were a face of the company. We would go and talk to the physicians about our products and research potential and that sort of thing, and educate them in that regards. And so I have a huge network. So when people do come to me and they say, well, Mark, even if it's outside my area of expertise, I say, hey, well, I know people that may know people.
Yeah.
I have to send them in the right direction. Sometimes even bypassing some of the weeks and months of getting seen by certain clinicians. I reach out to them and they say, yeah, I'll see them, but I just try to help people understand how to navigate the system, to understand, what type, if they're asking, if they're doing certain types of tests, kind of explaining to them, helping them to be an educated patient, what type of questions to ask the clinicians, because you need to know what they're doing to you. I mean, they're your medical team, but you still need to have an understanding of what's being done to you. And so I try to, that's kind of my focus.
I'm so glad you brought that up, because I think it's critical and growing in importance, because our system is increasingly impersonal, and as we're going more towards AI. But even like getting an appointment, and especially an older generation, a husband was trying to get an appointment. And, he's used to the old days where you just call the office, the receptionist would pick up the phone, you talk to the nurse, hey, can you get me in today? No problem, and then you have to go online. They don't respond back, and it's often confusing. And seniors have the most chronic health conditions where they're in the medical system quite a bit, and it just that alone is stressful. Trying to get an appointment with a cardiologist, and this, our next opening is 2 years from now.
That's right. Exactly.
And so it's often frustrating. How do you ask the right questions? You're nervous when you go into an appointment, and I think that's a really key role for coaches, to be that advocate, to help them feel prepared. And there's somebody who is one of our graduates that she'll if requested accompany her clients to a visit, and if they don't have a caretaker or somebody who is with them to help them, or talk about it after the visit, prepare them before the visit, and also sometimes communicate with their doctors when they have signed permission to do
that's
that
perfect.
as well.
That's exactly what's needed. A lot of people are fearful.
Yeah.
For the lack of information. And so they're like, well, what do I do?
Yeah.
Well, there's a lot of things you can do.
Yeah. Or the medical system is typically people get 7-10 minutes with a doctor, and wait a minute, they're out the door already. And I had so many questions and I didn't ask.
The paper that has all of these description.
Yes. Yeah. I like to say that coaches bring back bedside manner, because we know that is the key when in healing. It wasn't so much it's that connection, and a physician really having that. And so many in the modern medical system, so we have the great technology, but we've lost a lot of that. So
even with AI, the thing is, I think one of the biggest challenges that I see is sometimes you don't know what you don't know.
Yes.
And yes, you can read certain things, but sometimes it's very difficult for you to have the connectivity where there's one thing to have information, but if you don't really know how to apply that information, it still leaves you at a deficit. And so that's where I try to help people understand that connectivity piece.
Yeah. Yeah. That's so important.
Yes.
Wow. Well, this has been such a great conversation, Mark. Where can people find you?
Well, my website is MDB Life Connect. So it's MDBLiveConnext.com. So that's my website. So you can reach out to me anytime. I do have a book where my website is listed on that you can get at Amazon or Barnes & Noble's. A Matter of the Heart, My Unexpected Journey with Diabetes, because it was truly unexpected and it completely caught me by surprise. I was angry for years. I'm thinking, I was always a healthy guy, huh? How did I come up with this? Again, trying to fight through the stigmas. But one of the things I do in my book is I expose myself so that people can understand that you're not alone in this walk. And I try to help people understand. I think the biggest The biggest challenge that I have is helping people understand is not just about you, because what I also try to do is educate their caregivers and their those connected with them. If you see them and they're normally talkative, but they're just quiet one day, and they just you talk to them and they're not responsive. Check on them, make sure the sugar's not low, or if the sugar is dropping and they're normally a happy-go-lucky person, but they start snapping at you. Don't get upset. I mean, the human part of you, like, well, why are you so upset? But it could be, these things affect your brain, and your brain, affects your emotions. And a lot of times, all of this is impacted by this condition. So I try to help people understand that, it's not just you. It's also your tribe, your network, your foundation, I call it. And everyone needs to be educated, because this is not just about you, because you could be in a life-threatening situation and it may be someone else that discovers you need intervention, and that they could be there to help you out. So it's a big picture with a lot of moving parts, but I just try to help people understand their own personal condition, but also help the support staff to understand, okay, this is what they're dealing with. If you could be more sympathetic, more observant, and these are little tools that I can give you to kind of help, just to be aware of their situation.
Such important work that you're doing. Well, thank you for being with us today. It's been a pleasure to talk with you.